Hi, hello guys, welcome to Renis Nursing Academy, Nagercoil. Hope you all are doing good, staying safe. So today class உள்ள போலாம். class உள்ள போறதுக்கு முன்னாடி subscribe பண்ணாதவங்க subscribe பண்ணிக்கோங்க. பக்கத்துல இருக்க bell icon-ஐ click பண்ணிக்கோங்க. So that when I am uploading my next videos உங்களுக்கு automatically notificationsல show ஆயிடும். So இன்னைக்கு class உள்ள போலாம். இன்னையோட class எது பத்தி அப்படினு பாத்தீங்கன்னா it's an important pediatric condition under nervous system. So this condition will comes under an birth defect. So it is nothing but neural tubal defect. So normally நம்ம NTD அப்படினு சொல்லி யூஸ் பண்ணுவோம். So definition பார்க்கலாம். It's a failure of neural tube to close during the embryonic development. So as you all know about this embryonic development, fetal development எல்லாருமே படிச்சிருப்போம். So during the embryonic development என்ன ஆகும் அப்படினு பாத்தீங்கன்னா lumbosacral ஏரியால வந்து அந்த neural tube வந்து ப்ராப்பரா க்ளோஸ் ஆகாது. So that particular condition is called as NTD. Then it was given NTD தான் பாத்தீங்கன்னா காமனான birth defect அப்படினு சொல்லி கொடுத்திருக்காங்க. Then coming to the causes, it is primarily due to the deficiency of folic acid and vitamin B12 during the antenatal period. So you all know about the antenatal period care. நம்ம என்னெல்லாம் உங்களுக்கு health education கொடுப்போம். What are the types of supplements they have to take? Then what are the types of food items they have to take அப்படிங்கிறது நம்ம எல்லாருக்குமே தெரியும். So specifically antenatal periodல especially during the first trimester, that is first 3 months சொல்றாங்க 0 to 12 weeksல கண்டிப்பா the mother should take vitamin B12 and folic acid supplement. இந்த மாதிரி deficiency ஆகும்போது தான் the baby can develop a birth defect called NTD அப்படினு சொல்லி it was given. The reason is that ஏன் அப்படி சொல்றாங்க, why that folate or folic acid is that much important அப்படினு பாத்தீங்கன்னா this folate is responsible for the synthesis of RNA and DNA. நம்ம ஜெனெடிக்ஸ்லாம் பார்த்திருப்போம் இல்லையா. ஸோ நம்மளோட செல் மெம்பரேன் ஃபார்ம் ஆகுறதுக்கு DNA and RNA synthesis எல்லாத்துக்குமே folate play a major role. அப்போ இந்த folate deficiency ஆகும்போது there will be problems with the genetic thing and thus this problem called NTD is getting arised. Then இதோட types பாத்தீங்கன்னா there are so many types that will come under NTD. Example anencephaly, encephalosis and spina bifida. Of the whole the important common repeated patients க்கு babies க்கு develop ஆகுற problem என்ன அப்படினு பாத்தீங்கன்னா spina bifida. Coming to spina bifida, same, the definition is post vertebral arches lumbosacral areaல வந்து ப்ராப்பரா ஃபியூஸ் ஆயிக்காது. It will be open during the time of birth. That particular condition is called as spina bifida. இப்போ there are some subheadings that will come under the condition called spina bifida. That is, one is spina bifida occulta, then another one is spina bifida cystica. We'll see one by one. First one is spina bifida occulta. So occulta அப்படிங்கிறது என்ன அப்படின்னாக்கா it is commonly used term hidden split spine. அப்படின்னா என்னன்னா எக்ஸாம்பிளுக்கு எதை சொல்லலாம், we'll see about this fracture இல்லையா, closed fracture, open fractureலாம் படிப்போம் இல்லையா. அதில் closed fracture will be telling no example when I'm having some shoulder dislocation இருந்துச்சு அப்படின்னா என்னோட skin intact-ஆ இருக்கும், உள்ள fracture இருக்கும். அதே மாதிரி தான் coming to spina bifida, this occulta, what will happen inside, no, the problem will be, but the skin looks so intact and clear. வெளிய problem இருக்கிறது தெரியவே தெரியாது. That particular thing is called as spina bifida occulta. Here only one clue it was given, like crew like hair you can see on that particular area, no, you can see a crew like hair. So this is called as spina bifida occulta. So this type of questions they will ask you in case of your nursing licensure examination. இந்த மாதிரி what is the difference between spina bifida occulta and cysticaங்கிற மாதிரி particular இதோட characteristic features கொடுத்து கேட்பாங்க. What is this? So if you know this properly you can answer those questions. Now second one is spina bifida cystica. So spina bifida cystica, there will be two subheadings, that is meningocele and myelomeningocele. So இங்க என்ன difference இருக்கும்னு பாத்தீங்கன்னா coming to occulta, cystica-ல என்ன problem இருக்கும்னா I told you very clearly on the particular place ரொம்ப இன்டாக்டா இருக்கும், ரொம்ப கிளியரா இருக்கும், nothing you can see. But here in cystica you can see some protrusion. If just think this is my spine, na, on this particular lumbosacral area, no, you can see some protrusion outside. ஏதோ வெளிய வந்திருக்கிற மாதிரி open wound மாதிரி you can see. Okay, so that is called as cystica. In here cystica there are two types, meningocele and myelomeningocele. This is very very important. Here let me tell you how to differentiate meningocele and myelomeningocele. So first one is meningocele. So here, no, protrusion of meninges will be there. There will be no involvement of spinal cord at all. This is very very important. Meninges மட்டும்தான் இன்வால்வ் ஆகும். There will be protrusion of meninges alone. Spinal cardக்கும் இதுக்கும் என்ன சம்பந்தமும் கிடையாது. That is called as meningocele. Then coming to myelomeningocele, நீங்களே guess பண்ணிருப்பீங்க. Yes, here no, there will be involvement of spinal cord along with this particular meninges. Spinal cord will get involved. So that is called as myelomeningocele. Clear? So here no, இந்த myelomeningocele வந்து இன்னொரு additional feature இருக்கு. That is that there will be no, due to the protrusion of the spinal cord and all, you can see some leakage. So leakage na nothing but CSF. So நீ CSF nerve roots எல்லாமே உள்ள இருந்து leakage ஆகி protrude ஆகி வெளியே வரும். That is called as myelomeningocele. Then coming to the particular diagnosis. So diagnosis, how you can diagnose this அப்படின்னு பார்த்தீங்கன்னா, it's all about antenatal examination தான். During the time of pregnancy itself we can find it out. So primary intervention of this diagnosis எது கொடுத்திருக்காங்கன்னா ultrasonography கொடுத்திருக்காங்க. Then secondary என்ன கொடுத்திருக்காங்க அப்படின்னாக்க MSAFP, that is nothing but maternal serum alpha fetoprotein. So alpha fetoprotein வந்து during the first trimester எடுத்து டெஸ்ட் பண்றாங்க, so that we can find out this spina bifida or NTD, we can find it out. Now next important topic is that about the symptoms. So what are all the symptoms you can find out in this particular children? என்ன இருக்கும் பாத்தீங்கன்னா, first one is visible spinal defect. Yes, of course, I told you no, there will be some protrusion. So protrusion இருக்கும்போது கண்டிப்பா you can see some visible spinal defect. Then coming to next symptom, paralysis of the leg. Lumbosacral area involvement இருக்கிறதுனால கண்டிப்பா you can see paraplegia with the baby. Then bladder dysfunction, this is also same, due to the involvement of this lumbosacral area there will be bladder dysfunction, especially you can see bladder dysfunction. The next one is hydrocephalus, you can see, because you automatically you know the CSF will go high இல்லையா, CSF அதிகமாகும்போது கண்டிப்பா you can see enlargement of the head, that is nothing but hydrocephalus. Then as it become an infection, you can see increased body temperature with the baby. Then meningitis and its associated symptoms. I told you very clearly, meninges will get involved. இப்போ meningitis ஓட எல்லா symptoms வரும். Example, photophobia we can see, irritability we can see, increased ICP we can see, enlarged head we can see. So this type of symptoms related to meningitis will be coming under this particular spina bifida. The last one is treatment. In treatment, no, this type of question they used to ask, like இந்த மாதிரி ஒரு spina bifida baby வந்து எடுத்துட்டு வராங்க. The example, open spina bifida baby எடுத்துட்டு வராங்க. You are working in emergency. So baby receive பண்ண உடனே immediate nursing care என்னவா இருக்கும் அப்படின்னு சொல்லி கேட்பாங்க. So the priority nursing care is about protecting the particular sac. You already know it will be like a open wound. Open ஆ protrude ஆகி வெளியே இருக்கும். So what you can do is you can cover that particular area with a sterile moist gauze வச்சு நீங்க வந்து அந்த இடத்தை கவர் பண்ணி வைக்கலாம், so that no you can protect it from infection. Then second one is position. The priority position given is prone position you can give, because the baby is having problem on the back, no, so பாப்பாவா supine படுக்க வைக்க முடியாது, you can go for prone. The next one, this is very very important, diapering is contraindicated. You already know when you are putting the diaper for the baby, no, it will reach the lumbosacral area. So already problem is there on the lumbosacral area, so you are not supposed to put diaper to the babies. The next one, Foley's we can give, but only intermittent Foley's is applicable here to prevent infection. Then another one important method can be implemented here, that is called as CRED method, CRED, CRED method. So CRED method is nothing but you can give some nice massage over the symphysis pubis. So நம்ம இந்த மாதிரி பண்ணும்போது the nerve gets stimulated so that the baby can void. So அப்படி இல்ல CRED method use பண்ணி if the baby is not voiding na, you can go for the next step called Foley's, that is intermittent Foley's போகலாம். The next one, this is very very important, latex allergy. Latex glove போட்டு you are not supposed to handle the baby, because easily the baby will develop meningitis. So latex allergy வந்து you have to check for the baby. Then finally, constipation precautions or preventive measures எடுக்கலாம். Example, you can go for high fiber diet, fluids கொடுக்கலாம். If nothing is working out na, finally you can go for suppositories. So these are the priority management which was given under spina bifida. And the last topic of this is about prevention. So in the beginning itself, I clearly mentioned that the main cause for the spina bifida is only due to the deficiency of folic acid and vitamin B12 during the time of antenatal period. So what we can do? Yes, we can give health education to the mother during the time of antenatal visit. You already know about this antenatal visit, when the mother has to come, when they have to come to the hospital, then take all the precautions. In that due time, no, as a nurse we can give them health education regarding the folic acid supplement, vitamin B12 supplement. Then what are the food items that are rich in folic acid? Example, cauliflower. So this type of food they can take, so that they can prevent an important birth defect called neural tubal defect. So that's all about the condition called neural tubal defect under the spina bifida. Hope this class was very useful to you all, and I will see you soon in my next upcoming classes. Thank you so much. Stay safe.